Hi, I'm Dr. Charles Takyi, a consultant obstetrician gynecologist and a fertility specialist at the Korle Bu Teaching Hospital. Today we'll be talking about infertility and its overview in Ghana. Infertility is described as inability of a couple to be able to conceive within a 12-month period or 1 year after continuous uninterrupted intercourse, sexual intercourse. That definition in those who are about 35 years and above, for women who are 35 years and above, changes to about 6 months. So for those people, what happens is that the definition of infertility starts after 6 months of regular uninterrupted sexual intercourse, by which time the couple should seek help. The prevalence of infertility worldwide is said to be within the range of 15%, which, if broken down, is about 1 in 6. For every 6 couples who visit the clinic in a year, one of them will have a case of infertility. In Ghana, infertility could be primary or secondary, and there are various causes which I will delve in subsequently. The primary infertility is couples who have not been able to conceive after 1 year of unprotected sexual intercourse and who have never had any pregnancy in their lifetime. That is primary infertility. When it comes to secondary infertility, it's couples who have had at least 1 pregnancy, whether it doesn't matter whether successful or not. So we'll now delve into the causes of infertility in general. The causes of infertility could be male or female or combined, and sometimes unknown or indeterminate, because you can do all the investigations, you will not be able to find the causes. I will start with the female causes of infertility. This is just a diagram showing the anatomy of the female pelvis. And as you can see, you have the ovary on one side, on both sides, the tube, the female fallopian tube on both sides. Then you have the uterus, which is the womb in the middle, and then the cervix, that's the mouth of the womb. Any problem, usually normal reproduction is said that for a woman to get pregnant, there's ovulation, that's the egg is released every month, which goes through the tube and comes to meet the sperm in the tube. And then there's fertilization, after which the fertilized embryo will implant in the womb. And pregnancy continues if there's no problem. However, in the causes of female infertility, there could be problems with the production of the eggs, that's the ovulation, or there could be problems with the transport of the egg or the embryo in the tubes, or you could have problems that prevent the embryo from settling or implanting in the womb, or there could be problems that could impair the sperm from even penetrating the cervix to go and then fertilize the egg in the fallopian tube. Other factors could be due to hormonal changes, or sometimes some couples or the women may not have any of these structures in place, in which case during the investigation that can come up for the female causes of infertility. One major problem of female infertility is the tubal blockage or tubal damage. And most of it is as a result of pelvic infections like sexually transmitted infection, pelvic inflammatory disease, endometriosis, and it's one of the major causes of female infertility in Ghana. When it comes to the problems with the womb, we have issues such as adhesions, uterine fibroids, others who have other problems in the womb that can prevent implantation of the embryo in the womb. Ovulation problems are also common in female infertility. Women who are not able to ovulate regularly, such as polycystic ovaries syndrome, which is coming up strongly in Ghana. Women who have premature ovarian failure or insufficiency is another problem. And those who have other problems like thyroid disease and other hormonal issues are also affected when it comes to ovulation, and that can lead to infertility in the female. Now let's talk about the male causes of infertility. So with the male's causes of infertility, it could come from inability to produce the sperm from the testes. It could also come from those who are able to produce the sperms, but there's obstruction in the pathway before the sperms are released, or there are problems with ability to have ejaculation. Premature ejaculation is also another cause. Others may have inability to have complete erection, and erectile dysfunction is also another issue. And there are other hormonal issues such as low testosterone and all that. These can lead to male infertility. The causes of male infertility is approximately about the same as the female causes of infertility, which about 40% each. And we have about the combined causes of infertility hovering about 10% to 20%. And a smaller proportion of infertility is known to be undiagnosed or indeterminate, because you do all the tests in the world, you still not be able to find the cause of infertility. And then we have other factors that can lead to infertility. The last part of the causes of infertility is the one that cannot be diagnosed. We've done all the investigations, you cannot find the cause. With that one, there's treatment options available, which will be discussed in the subsequent presentation by my colleague. What is the take-home message? We should know that infertility is a couple's disease, and it's not only for the man or the woman. The other thing is that sexually transmitted infections, pelvic infections, should be treated as soon as it happens, so that we prevent complications such as ectopic pregnancy, tubal blockage, and infertility subsequently. There are treatment options available at the Korle Bu Teaching Hospital for the management of infertility at the gynae unit. That is where I work, at the Korle Bu Teaching Hospital. So people can present if they have issues with infertility, and we will help them. Thank you so much for having time with me. My name is Dr. Charles Takyi, a consultant obstetrician gynecologist at the Korle Bu Teaching Hospital. In our next episode, my colleague will present on the prevention of infertility, its management, and other modalities for infertility treatment. Thank you.